Assalamu alaikum wa rahmatullahi wa barakatuh. Today we shall discuss about diabetes mellitus. Diabetes mellitus is one of the most common causes of death, and globally it kills around 1.6 million people annually, and around another 2.2 million people are killed because of the indirect consequences of diabetes mellitus. What's more is that nearly half of all those deaths which are attributable to high blood glucose occur before the age of 70 years, which means that diabetes actually kills people at a very young age. If we look at some data that is available and we compare the diabetes as a cause of death in the year 1990, then diabetes ranked as number 16 as the most common cause of death, but in the year 2019 it has jumped some 8 ranks and now becomes the 8th most common cause of death. And the same statistics applies to India as well. If you look that in the year 2019, diabetes was the 11th most common cause of death, and in 2019 now it's the 8th most common cause of death, a jump of around plus 54.2%. Now, looking at some of the statistics that is related to diabetes, it is estimated that in the year 2019 there were some 463 million people in the age group of 20 to 79 years who had diabetes, and this number is expected to rise to around 700 million by the year 2045. And there are some 1.1 million children and adolescents who are living with type 1 diabetes as of 2019, and another 20 million live births are affected because of diabetes. Now, what is important in public health point of view is that around half of all those 463 million people are actually undiagnosed. That's around 232 million people in 2019 have been estimated to be undiagnosed. And more importantly, 374 million people are at risk of future diabetes. If you see, around 79% of all cases of diabetes mellitus live in the lower and middle income countries. And if we look at the statistics for the elderly population, then around 1 in 5 elderly above the age group of 65 years have diabetes mellitus. The contents of today's presentation will start with an introduction of diabetes. We'll discuss etiology, the classification of diabetes, the diagnosis of diabetes, the risk factors of diabetes, diabetes related complications, and more importantly, the prevention of diabetes. Now, diabetes mellitus is a group of metabolic disorders characterized and identified by the presence of hyperglycemia in the absence of treatment. The etiology includes defects in insulin secretion, insulin action, or both, and disturbances of carbohydrate, fat, and protein metabolism. Not all diabetic patients would present to your clinic with the characteristic symptoms of thirst, polyuria, and hunger, but some of them may present with ketones in the urine, dehydration, and coma in the emergency department. The proportion of undiagnosed cases of diabetes ranges between 30 to 80% depending on the country. 14th November is celebrated as the World Diabetes Day in recognition of the work done by Frederick Banting, who discovered insulin. The etiology of diabetes. The etiology is mostly related to the beta cells of the pancreas, Diabetes is usually caused because of the dysfunction or destruction of the beta cells, which may be because of a genetic predisposition, epigenetic processes, insulin resistance, autoimmunity, concurrent illnesses, inflammation, and environmental factors. Type 1 diabetes mellitus usually results from the destruction of beta cells, which is usually accompanied by detectable autoantibodies to components of the beta cell, which indicates an autoimmune process. Type 2 diabetes, which is more common of the different types of diabetes, usually results from a combination of resistance to the action of insulin and insufficient insulin production by the pancreas. The classification of diabetes, the World Health Organization recognizes 6 major types of diabetes. These are type 1 diabetes, type 2 diabetes, hybrid forms of diabetes, other specific types, unclassified diabetes, and hyperglycemia first detected during pregnancy. The diagnosis of diabetes. There are 4 major tests that we use for the diagnosis of diabetes. These are fasting plasma glucose, 2-hour post-load plasma glucose after a 75-gram oral glucose tolerance test, HbA1c, random blood glucose in the presence of signs and symptoms of diabetes. This figure over here will guide you through the different cutoffs that have been determined for the diagnosis of diabetes using fasting plasma glucose or an oral glucose tolerance test or an HbA1c. In short, a person having a fasting plasma glucose of more than or equal to 126 milligram per deciliter and plasma glucose of more than 200 milligram, more than or equal to 200 milligram per deciliter following an oral glucose tolerance test, and an HbA1c or an HbA1c of more than or equal to 6.5% will be labeled as having diabetes mellitus. Then there are other categories as well. For example, we have pre-diabetes, which we'll be discussing in the later slides. Special mention should be made of hyperglycemia first detected during pregnancy. There are 2 forms or 2 categories of hyperglycemia when first recognized in pregnancy. One is diabetes mellitus and the other is gestational diabetes. The cutoff levels for definition of gestational diabetes are lower than that for diabetes. So the criteria for diagnosis of gestational diabetes are fasting plasma glucose 5.1 to 6.9 millimoles per liter, or 1-hour post-load plasma glucose greater than or equal to 10.0 millimoles per liter, or 2-hour post-load plasma glucose 8.5 to 11.0 millimoles per liter. Mention should be made of pre-diabetes as well, and we can have 2 forms of pre-diabetes: the impaired glucose tolerance and impaired fasting glucose. Impaired glucose tolerance and impaired fasting glucose are an intermediate state of hyperglycemia with glycemic parameters above normal but below the diabetes threshold. And here is how the World Health Organization defines impaired fasting glucose and impaired glucose tolerance. So just remember that the World Health Organization and the American Diabetes Association slightly differ in the way impaired glucose tolerance and slightly differ in the way impaired fasting glucose is diagnosed. The American Diabetes Association has the same cutoff for impaired glucose tolerance but has a lower cutoff value for impaired fasting glucose. The risk factors of diabetes mellitus. The risk factors of diabetes mellitus. So before we discuss the risk factors of diabetes mellitus, please go through this case scenario, which we shall discuss in detail during our classroom discussion. Mushtaq Ahmed, 42 years, taxi driver, living in a densely populated, poor neighborhood of Srinagar, has been recently diagnosed with diabetes by a health practitioner in his locality. He is the sole earner in a family of 6 members, which includes his ailing mother. He knows that diabetes requires lifelong treatment, which has made him worrisome. He does not know what health insurance is. He leaves home early every morning and returns late so that he can sufficiently feed his family of 6. There are no open grounds nearby, and people in the neighborhood are not in the habit of going for walks. He knows a good number of people in his locality who have diabetes. The risk factors of diabetes are genetic susceptibility, environmental risk factors, which include viruses, nutrition, and hygiene. The risk factors for type 2 diabetes mellitus can be classified as unmodifiable risk factors or modifiable risk factors. The unmodifiable or the non-modifiable risk factors for type 2 diabetes mellitus are age, familial and genetic risk factors, previous gestational diabetes, and ethnicity. The modifiable risk factors for diabetes, type 2 diabetes are obesity, physical inactivity. These are the 2 most important risk factors for type 2 diabetes mellitus, and most of the other risk factors are indirectly related to these 2 risk factors. But there are others as well, and some other important risk factors. For example, the aspects of diet, smoking, birth weight, intrauterine environment, and epigenetic changes, which possibly work through something known as the thrifty phenotype hypothesis, which we might discuss in the classroom if we have some time. Then there are biological risk factors, which include pre-diabetes and metabolic syndrome, and most importantly, the social determinants of diabetes. This picture over here shows us the different diabetes related pathways which are determined by the social determinants of diabetes. You may think of this as the sort of a web of causation for diabetes. So if you can, please take a screenshot of this particular slide, and we'll be discussing more about this very important topic about the risk factors, which is also related to the prevention of type 2 diabetes mellitus during our classroom discussion. The diabetes related complications. The diabetes related complications include the macrovascular complications, the microvascular complications, which include diseases of the eye, renal, and the neuropathy and diabetic foot problems. Then there are others like erectile dysfunction, depressive illness, non-alcoholic fatty liver disease, some cancers, and there are other complications, very important complications, which include diabetic ketoacidosis, which is more common in type 1 diabetes, hyperglycemic hyperosmolar non-ketotic syndrome, which is more common for type 2 diabetes, and hypoglycemia. The prevention of diabetes. Once we understand and fully understand the different risk factors for diabetes, we can think of the different ways of preventing diabetes. Diabetes mellitus prevention includes prevention of type 1 diabetes. The risk factors for type 1 diabetes are not as fully understood as we have the understanding for type 2 diabetes mellitus. But even then, although it's possible to identify some individuals who are at risk for type 1 diabetes mellitus, this is a very costly and labor-intensive affair. Therefore, it's currently not feasible to go for a true primary prevention of type 1 diabetes mellitus. And a lot of work is underway to understand the different pathways for the etiology of type 1 diabetes mellitus, and research is possible for the different interventions which we can have for the prevention of type 1 diabetes mellitus. More of the preventive measures are restricted to the prevention of type 2 diabetes mellitus, which is in real sense a disease which can be prevented at a very early stage. The intervention measures may target only the individuals at risk, or we can have some population-wide approaches. As I said, once you understand the etiology of diabetes and once you understand the different factors that are related to the causation of diabetes, which includes obesity, physical inactivity, smoking, the aspects of diet, and more importantly, the social determinants of diabetes, we can understand what type of intervention do we want to have at the targeting the individuals at risk or for the population as a whole. But the challenge it lies in finding ways to make these interventions actually work in everyday healthcare and community settings. The prevention of diabetes-related complications. Please go through this case scenario. Shamima is a 54-year-old woman who has been admitted to the emergency department with complaints of altered level of consciousness and seizures. Blood investigations reveal non-ketotic hyperglycemia. She lives in a posh urban locality and works as a desk assistant at a state-owned company. She comes from a well-off family. Her 2 children are studying in Europe. She stays with her husband. They have hired a maid for household chores. She has never got her blood sugar checked in the past. Her father died some 10 years back. He was diabetic. I would like you to think more about this case, and we'll be discussing about different aspects of this case during our classroom discussion. The control of blood sugar, blood pressure, blood lipids, and the avoidance of smoking are the core interventions in prevention of diabetes-related complications. So when we say prevention of diabetes-related complications, we are actually talking about what we traditionally call as the secondary preventive measures, or the secondary level of prevention. Specific measures to reduce the incidence of sight-threatening retinopathy, morbidity, and loss of the lower limbs, and progression to end-stage renal disease are needed. For example, annual screening for microalbuminuria, annual eye examinations, etc. Self-care is important if we want to prevent the complications of type 1 or type 2 diabetes mellitus, and empowering people with diabetes with the knowledge and support they need is required. So I have shared the bibliography or the different sources that I have used for preparation of this lecture. So some of you may want to go through some of those resources. I recommend at least you should look for the classification of diabetes mellitus, Geneva World Health Organization 2019, and you should go through the diabetes, equity, and social determinants. These 2 references are really very important in context of diabetes mellitus. And if you want to look at the different data for diabetes, I have shared a link over here, and this is a very important source for all health data, including diabetes mellitus. Thank you all for your patient listening.